And there we go. Good afternoon, everyone. It's 1 minute after 1. I'm sorry I'm late. I was just filling up my water bottle, which is always important to hydrate while we're exercising. So welcome to our live webinar for Tuesday, June 16th. We're going to be doing another exercise session as we've been doing regularly on Tuesdays and Thursdays for the last little while. So let me just get my tech working. And we can get going. So my name's Rob. I'm your host, one of the cardiac rehab supervisors here, and I'll be taking you through fairly low intensity exercise routine. It's our plan for today. Just a couple of reminders before we get started that there's a fair number of people who can tune into these things. And of course, I don't know everyone's background or medical history. So this program is meant to be designed for people who are regularly participating in a cardiac rehab program. If you're not, at the very least, you should talk to your doctor and say, hey, am I safe? Am I okay to exercise? As I said, this is fairly low intensity, so it's pretty appropriate for most patients. You shouldn't have a problem with that. We always say we should be looking to exercise 5 days per week. I do these on Tuesdays and Thursdays, but my colleague Crystal, who's supporting me in the background, records them and she puts them up on our website. So if you'd like to get a third, fourth, and even a fifth workout in during the week, excuse me, you can always watch one of these recorded sessions and follow along that way. The exercise that we're doing is going to be good for you. It's going to get the heart rate up a little bit, make you breathe a little bit more, get those muscles working a bit, but it shouldn't be painful. All right, you should feel comfortable. You should feel breathing go up a little bit, but you should not have any pain. If you do have any pain, you should stop the exercise, sit down and relax. Hopefully the pain will go away. If the pain still doesn't go away, then of course you should access your emergency services as appropriate. Okay, so hopefully everyone's feeling well before they start the exercise. No symptoms, so no chest pain, no shortness of breath, dizziness, lightheadedness, palpitations, nothing out of the ordinary for you. Hopefully you've taken your medications, and for those of you that are diabetics, that your blood sugar is at a good, safe level for exercise. The Goldilocks rule, not too high, not too low, just right, just in the middle. Okay, so let me stop my screen share here. There we go. You can see my smiling face, and let's get started. Okay, so as always, the first thing we want to try and do when we start our routine is get a resting heart rate. So if you can find your pulse at either your wrist or in your neck, whichever you prefer, you can find that. I'll give a solid 10-second pulse counts in 3, 2, 1, start. And stop. So hopefully you've got a number that is normal for you. Resting heart rates do vary a fair bit. They normally say anywhere between 10 and maybe 16 is quite normal. A lot of our cardiac patients, their heart rates might be at rest lower than 10 because you have medications that are designed to have your heart rate slow down a little bit. Okay, so we're going to start off with our dynamic warm-up. We do four exercises for our dynamic warm-up just to get ready for our exercise. So we start off with some marching on the spot. Get those big muscles in the legs warmed up. Loosen up the hips and the knees a little bit. If you've got good balance and you'd like to, you can always add some arm motion into this as well. But don't feel you have to. It's entirely up to you. Okay, next thing we're going to do is we're going to loosen up our hips. So grab onto something solid that's not going to move. I'll use our fridge. Stand up nice and straight and tall. And then just slow, deliberate movements from your hip. Just wake the joint up, get it moving. Nothing too aggressive. Okay, and then let's move to the other leg. Remember to stand up nice and straight and tall, looking forward. I look over my shoulder so that you guys can hear me. I don't have a microphone or anything fancy for these live casts. Crystal, if you're out there and you hear me, see if we can get me a microphone. Okay, so that's good with the hips. Next thing we're going to do is we're going to loosen up our ankles. So just lean against something for a little bit of balance. And try and draw big circles with your big toe. And make sure you get both directions. And then let's move to the other foot. And both directions. Okay, and let's just finish off with some shoulder rotations. Loosening up our shoulders, and make sure you get both directions. All right, so that's our dynamic warm-up. Now we're going to begin with the cardio warm-up. So as hopefully everybody knows, the cardio warm-up is just whatever exercise you're going to be doing. In our case, it's just marching on the spot in our kitchen. Just do that activity a little bit slower, a little bit easier. What that does is it allows the arteries that bring oxygen-rich blood to your heart, your coronary arteries, lets them dilate. More oxygen-rich blood we can bring into our hearts. We'll make sure the heart works a little bit better, less likely to get any shortness of breath, any skip beats or arrhythmias, or any angina. You do a good warm-up. Likewise, it'll also give our body a chance to bring some oxygen-rich blood to our working leg muscles. They're going to do work. They need more oxygen-rich blood to do that work. So your body's going to make the hemodynamic changes. There's a big fancy word for the day. And hopefully everybody knows we do this for about 4 or 5 minutes just to get ready for our exercise. So these sessions are called Walk and Talk with Rob. So we always got to try and find something to talk about. I think today we had a question last week come in at the end of the session that was just asking about something called regression of coronary artery disease. Not sure if those were the exact words that were used in the question, but that was the context. So what can we do about blockages that we may have in our coronary arteries? Is there any evidence out there that says we can actually make them smaller on our own? And if there is, how do we go about doing that? So that's going to be our topic of conversation for today. I do know there were 2 other questions that I have yet to answer. There was one just around diabetes that is on our list. I'm going to see if I can get my colleague Renee Canitas to join me for one of these and talk about diabetes. And then the other one is just about using poles, doing some pole walking. And we're trying to find a good resource for that. I have to apologize. I know the physiology behind pole walking, but I don't know how to teach people how to do it effectively. So we got to see if we can find some resources for that. So those are the 2 outstanding questions I have. Question we're going to talk about today, reversing coronary artery disease. If anybody else has any other questions that or things you'd like me to talk about after the session, put them in the question and answer box for me, if you don't mind. Got a lot of things I could talk about, but I like to talk about stuff you guys at home would like to hear. About 3.5 minutes of our warm-up, so we'll just do another minute or so. And then for those of you who'd like to, you can pick up the intensity and effort a little bit, and we'll get going with the main cardio portion of our workouts. Don't forget, especially with the warmer weather out there, that hydrating is important. So it's a good idea to have a little bit of water before you start your workout. And then feel free to have a sip here and there while you're working out. If you're on a fluid restriction, do be careful. Some patients are told they have to be careful with how much water they drink. If that's the case, do follow your doctor's instructions, not mine. Okay, so we're warmed up. Feel free to pick up the pace a little bit if you'd like. If you're comfortable, you can add some arm motion into your exercise. The more muscle you use, the more work your heart has to do. So depending on the level of fitness you have, the level of exertion you'd like to do, you can vary this. So for today, we were going to spend some time talking about something called regression of coronary artery disease. So what is this? All right, well, we know that coronary artery disease is a condition, applies to the plumbing part of the heart, the coronary arteries. Something acts on the lining of the coronary artery to damage and weaken it. This kind of lays the groundwork for the beginning of coronary artery disease. We talked about this a little bit last week when we were talking about stents. Once the arterial wall is damaged and weakened, stuff starts building up in the wall. Excess cholesterol, smooth muscle cells, white blood cells, calcium. All this stuff starts getting deposited into the weakened area of the arterial wall. And then as more stuff piles in there, starts to bulge into the middle part of the artery. Anybody remembers that's called the lumen. The lumen is a part of the artery where all the oxygen-rich blood flows through. And as this blockage starts bulging into the lumen, that leaves less and less room for oxygen-rich blood to get through. That's what coronary artery disease. It's a situation where you restrict the flow of blood potentially to part of the heart muscle, and that's not a good thing. A heart muscle needs oxygen-rich blood, just like every cell in the body. So once a blockage gets to about 50% size, that's roughly when it's going to start to affect blood flow. Maybe a little more, maybe a little less, but around 50%. And as it starts to affect blood flow in a negative way, your heart might complain about that a little bit. Might not move as well as it should, might not pump as effectively, might irritate the electrical system. You can get some misfiring, skip beats, or arrhythmias. Or more commonly, it can cause symptoms. This symptom is called angina. We've talked about angina in the past. Usually at about 50%, we can manage these problems with medications. We can give you a medication like a beta blocker. These are medications that end in OL, metoprolol, atenolol, bisoprolol, sotalol, orbitalol, nadolol. There's a lot of them. And one of the great things that beta blockers do is they slow down your heart rate, they slow down your blood pressure. And by doing this, your heart's not doing as much work. If it doesn't do as much work, it doesn't need as much oxygen-rich blood. That's a great thing if you've got a blockage, right? You've got a blockage and you can't supply as much blood as you'd like to. Well, decreasing the need for that oxygen-rich blood is a good thing. Between 50 and around 70%, a lot of the time medications can manage those situations pretty good. But once you get to 70% plus, it's a pretty decent blockage. It can sometimes be hard to manage this with medications alone. And that's when your doctor might intervene with an angioplasty and stents. They can't do that, or if you've got multiple problems they need to fix, maybe they look at bypass. There's a whole bunch of reasons for why they might do one type of procedure versus another. Your doctor can talk to you about those ones. But people often say, well Rob, can I try and fix this problem on my own? And that's what I'm going to try and address in the next 9 minutes, 8 minutes or so. We spent an awful lot of time trying to learn as much as we could about coronary artery disease. And we've learned an awful lot about the risk factors that can lead to the development and progression of coronary artery disease. And these are all things that we've heard about: cigarette smoke, high cholesterol, diabetes, high blood pressure, diabetes, blood sugar, lack of exercise. All the classical risk factors lead to the development, various mechanisms, and progression of coronary artery disease. So once we started to learn that these things cause or worsen coronary artery disease, somebody came up with a pretty obvious, intuitive question, I think. Well, if we know these risk factors can make coronary artery disease worse, if we get them really under control, can we make coronary artery disease better? So this was a question that was asked back in the 70s and the 80s, trying to figure out if it could be done. And one of the first guys to try and answer this question is a guy named Dean Ornish. Now, Dr. Ornish is a cardiologist down in the States. I think he's in California. And he did a study called the Lifestyle Heart Trial. He's written a book about it, Reversing Heart Disease. You can get it in the bookstore by Dean Ornish. Basically what he did is he said, listen, we know that these risk factors contribute to making blockages worse. Let's get a group of people and really control these risk factors aggressively and see if maybe we can get the blockages to shrink. So he took a group of people, enrolled them into his program, split them up into two groups. So half of the people were randomized to what they call the usual care group. So they received the typical treatment that heart patients would get in the 80s. This is when the study was done. And the other half were randomized into Dean Ornish's intervention group, his program, if you will. And his program really had, I guess, three components that he was trying to control. One was sedentary behavior. So exercise was a big part of his program. Dr. Ornish asked his patients to exercise regularly. The other one was diet. Right? We knew that diet played a big role in the development and progression of coronary artery disease. So Dr. Ornish asked his patients to follow a really strict low-fat diet, very low, less than 10% in calories from fat. And the third thing was stress. All right, so we figured that, and it's correct, stress contributes to the development and progression of coronary artery disease. So let's get my people to practice stress management on a daily basis. So those were the three things that people in Dr. Ornish's program did. He followed everybody. Oh, sorry, I forgot this part. This is what happens when I try and talk without my fancy PowerPoints. At the start of the study, to make sure that everybody had coronary artery disease, everybody had an angiogram. So back then, they went in through the groin, threaded a catheter up into the coronary arteries, did an angiogram, and in every single participant in the study, they had well-documented coronary artery disease. So we knew they had blockages. So randomized people, half go into the usual care, half go into Dean Ornish's program. After a year, he brings everybody back and repeats the angiogram. He wants to see what's happened with the blockages. And what he found was that people that were in the usual care group, so they did the typical stuff that people did in the 80s, sure enough, their blockages had progressed a few percentage points. Things got a little bit worse. But he was quite surprised, pleasantly surprised, that the people that participated in his program actually had their blockages shrink a little bit. Not much, 2-3%. But the blockages were actually measurably better. So this was a really cool study because it was one of the first studies that actually showed that through lifestyle, you can get blockages to actually shrink in some instances. I have to point out the number of people in this study was not huge. I can't remember the exact number, but it was a couple of dozen. So not really big numbers. But with the angiograms, they were able to prove that the blockages did shrink a little bit. So this was pretty cool stuff, pretty groundbreaking stuff. Shortly after Dr. Ornish did his study, another guy named Dr. Hamstrings in Heidelberg, Germany, did a similar study. He took a group of people with documented coronary artery disease, so basically angiograms on these guys and showed they had blockages. Same thing as Dr. Ornish, splits them up into two groups, half were randomized into usual care, half participated in Hamstrings' program. And this is where I get to put on my little hat here. Our program that I'm part of, very proud to say I'm part of, is one of the oldest cardiac rehab programs in the world. So this program was founded by Terry Cavanaugh in 1967. So it's been around for like going on 53 years. It's a pretty famous program. So when Hambrick did his study, he took a look at our program and he modeled a lot of the stuff that he asked his people to do on what we were doing. So he asked his patients to exercise for 30 to 60 minutes 5 times per week, which is similar to us. We ask our patients to exercise at least 30 minutes, ideally up to an hour, 5 times per week. And he asked his patients to follow something called the American Heart Association Step 2 diets. This particular dietary pattern says that no more than 30% of your calories should come from fats. Only a third of that should be saturated fat. This diet is pretty much the same as Canada's food diet. And for those of you who have spoken with our dietitians, Betim and Veronica, you know this is the kind of advice that they give, is to follow Canada's food diet. So half of the people participated in Hambrick's program, half in usual care. And then at the end of a year, brings them all back, they do angiograms again. And Hambrick confirms what Dr. Ornish found. A bunch of his people, blockages were able to actually shrink a little bit. It's important to note, it's not like you've got a 50% blockage that goes away. You might have a 50% blockage that shrinks down to 48 or 47%. So not massive, massive changes, but it's possible. And it was possible through lifestyle. And as somebody in this environment, that's what we push. It's all about lifestyle. This is pretty cool stuff. So Hambrick is a big fan of exercise. So Dr. Ornish, when he did his study, Dr. Ornish will typically say that you got to take a look at heart disease in its entirety. You can't only do stress or only eat right or only exercise. You need to look at everything. It's a good holistic view. I agree with that. You really need to try and address all of your risk factors. Dr. Hambrick, being an exercise guy, wanted to take a little bit of a closer look at the exercise contributions to reversing coronary artery disease. And one of the things that he found is something that we would kind of make sense. The people that did the most exercise tended to be the ones that demonstrated the most regression or improvement of blockages. And the ones that did the least amount of exercise tended to be the ones that stabilized or had progression of disease. So that's kind of what we would think. You walk more, you get better results. The question that we had last week about this was just about volumes of exercise, or how much do we need to walk. Dr. Hambrick's study was actually pushing for 2,200 calories per week. It's about 21, 22 miles of walking per week. Increased the odds in his study that you get some improvement in your blockages. If you walked about 15 miles per week, that typically in his study was the break-even point. So blockages didn't get any better, but they didn't get any worse. And of course, if you're below the 15 miles per week, that was associated with worsening of blockages. And I know that a lot of our patients, when they first hear this, they'll get a little discouraged, right? Because I know a lot of you at home are not walking 22 miles a week. A lot of you are probably not going to be able to walk 22 miles per week. And one of the things that we take a look at in this particular study is those calories burnt per week. Now, I am making some assumptions here, and in the science world, that's never a good thing to do, right? But don't take a look at 22 miles. It has to be pure hard exercise. Take a look at this and think, what can I do to burn more calories every week? So, you know, when the mall is open, you get in the mall, instead of taking the elevator, maybe take the stairs. If you go to the grocery store, maybe you don't need to take the closest parking spot to the entrance. Park on the far side of the parking lot. You got to walk a little bit further. It's only an extra 1 or 2 minutes, but it's more calories. So when I normally put this slide up in my PowerPoint, I tell people not to focus on the so many miles per week of structured exercise. I tell people to try and do everything they can to lead an active lifestyle. Because I think we all can agree that a heart-healthy lifestyle is an active lifestyle. Okay, so let's get a 10-second exercising heart rate. So if you can find your pulse in your wrist or at your neck, I'll give you a 10-second count in 3, 2, 1, now. Keep your legs moving so you don't get lightheaded or dizzy. And stop. So hopefully everyone's got an exercising heart rate that's in your normal range. And just like with the resting heart rates, some people it's a little slower, other people it's a little bit higher. The same is true for your exercising heart rate. So at this point, you should be feeling pretty good. Breathing might be a little bit faster than normal because we are exercising, but no pain, no palpitations, no dizziness, just maybe a little bit tired from doing the exercise. So hopefully that answers the question that was asked about reversing coronary artery disease. We do have some more information about that on our website. And I have to apologize, I don't have a PowerPoint to show you guys. Truthfully, I normally do this talk with a whole bunch of wonderful slides. I show some examples of angiograms where the blockages have gotten a little bit better. Something called a nuclear perfusion scan with improved blood flow. Wonderful pictures, but all I can show you today is my fridge. So go take a look on our website. There's a lot more information on there if you'd like some more details. So we're just doing our cool down now. We'll do this for another minute or so, and then we're going to do a couple of exercises, and that'll be it for today. All right. So let's do our exercises today. If I recall, last week on Thursday, the leg exercise that we did was squats. So today we're going to do our step lunges. I'm a big fan of doing leg exercises. I think as we get a little bit older, having leg strength is so important. Helps our balance, helps us get out of a chair, off the toilet, all things that we take for granted until we struggle to do them. So leg exercises are my favorite thing to do. So we're going to do some step lunges for this. So I'd like you to hold on to something for a little bit of balance, something solid. I'll use my fridge. And then you're just going to step one leg out front. And then all you're going to do is you're going to lower your leg to the ground for 10 repetitions. Okay, just down like this. 1, 2, making sure that you're looking forward and standing up straight and tall. And the farther down you bring this knee, the harder the exercise is. So find a level where you feel a little bit of work in your thigh, and that's the level for you, no matter where it is. And as always, I've completely lost count. So I'm going to say this is 9. Now one more. 10. All right, let's switch. Let's do the other leg. I'm going to show you a slightly different angle here. But same thing, hold on to something for some balance. One leg in front of the other, and then you're just going to be lowering your back leg to the ground. Let's see if I can do this on this side here. 1, 2, 3, 4, 5, 6, 7, 8, 9. One more. 10. That works our thighs. Okay, so we're going to do an exercise that I haven't shown you before. It's called a tricep extension. Triceps works the muscles here in the back of the arm. For this one, just to kind of get you guys to have it, grab something that weighs a couple of pounds, use a water bottle, can of soup or something like that. And then what we're going to do is we're going to get a chair. Just going to rest on the chair with our arm. I'm going to have my arm here on the side, and then I'm just going to kick my arm back like this. Tricep is the muscle in the back of your arm. So let's just do this nice and straight. Only the upper or the lower part of my arm is moving. So from the elbow to my wrist. From my shoulder to my elbow shouldn't be moving at all. 5, 6, 7, 8, 9, 10. Let's do one more. I'm going to do it this way for a different view for everybody. 10 repetitions again. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Excellent. Those are some tricep extensions to work the muscles here in the back of the arm. Okay, we're going to finish up with our stretching. Start off with stretching the back of our arms, our triceps. So just holding that across your chest. You can feel free to bend your arm if you want a little bit more of a stretch. Making sure to breathe comfortably, don't hold your breath. Right, and then let's do the other arm. So straight out, across your chest, pull it across. Okay, and then we're going to stretch our chest through here. So if you can lace your arms behind you, great. If not, as close as you can get. And then pull your shoulders back, kind of looking up a little bit at the roof. Pull your chest back. And by the way, I'm a big fan of just kind of swaying a little bit left to right when you do this. Find if you stand perfectly still, some of you might get a little lightheaded and dizzy. I know I do. So I like to just keep my legs moving a little bit. Keeps the blood moving. Okay, that's good. Now we'll do our runner stretches. We'll stretch our calves. So find something nice and solid. One leg in front of the other. Both feet flat on the ground, pointing forwards. Making sure to breathe comfortably. And then let's switch legs. Excellent. And then we'll finish off by stretching out the back of our legs, our hamstrings. So one leg out in front of you, other leg bent, and then just sliding as far forward as you comfortably can. You feel the pull in the straight leg. Don't forget to breathe. Okay, and then let's switch legs. All right. Stand up. Shake your arms, shake your legs, pat yourself on the back. Good job with that workout. So let me just see if I have anything real quick here in my Q&A. What do we got? Someone dies from COVID. Does the virus die, or can it still be transmitted from the body? You know, that's a real good question, and I'm not going to answer that because I don't know what the answer is. I know that eventually the virus will die, but I don't know if that's a minute, a month, a year. I don't have a good answer for that one. I know there's lots of good resources online on the Canadian government website. I'm sure you'll be able to get the answer for that there. Is coronary disease the same as cardiovascular disease? It's going to be similar. There's a lot of words that are used interchangeably. So heart disease would encompass anything and everything that can happen with your hearts, and that's usually broken up into different categories. So one of those would be coronary artery disease. Cardiovascular disease is the same thing. The vascular system refers to the arteries and the veins. So coronary artery disease and cardiovascular disease, they would be the same thing. I listened to Dr. Heidemeyer's talk, Ashley, my good friend, Dr. Ashley, about gender differences in heart disease. Should women, me, do the same kind of exercises as men? Thanks. Yeah, I believe they should. I know that Dr. Heidemeyer actually worked with me here at the center for a couple of years, and we actually ran the heart failure program together. And the exercises that we get the men and the women to do is going to be largely the same. Whether it's walking or biking, there are orthopedic concerns that we might think about. If you've got a bad knee, you know, maybe hard walking is not for you. Maybe you should go on a bike. But I would answer that question the same for a man or for a woman. So generally speaking, the exercises are going to be very, very similar. There's nothing that jumps to my mind that a guy should do that a girl shouldn't, and vice versa. Can you demonstrate the leg curl with the bands? I can't seem to get it right as well. What would be a good alternative? So you see, I will demonstrate that. I can't do it now because I don't have a band with me. I'll try and bring one with me for the Thursday session, so tune in, and I'll try and show it there. I do know that we have a video on our website. If you go to cardiaccollege.ca, get active, resistance training, leg exercises, you can see the hamstring curl. That might help you. If not, I'll see what we can do on Thursday. Let me scroll down. My discussions are very informative. Thank you. Well, thank you very much for the compliment. I appreciate that. Where stems, I'm assuming stents are placed, does it eliminate the blockage 100% or not? So generally a stent will reduce a narrowing by a very, very significant amount, 95% plus. Cardiologist would be, an interventional cardiologist would be the best person to ask for that. I frequently see notes that'll say a 95% blockage was reduced to 1%, 3%, 0%. So it eliminates pretty much the entire blockage. You have to remember that as long as a blockage is going to be smaller than about 50%, it doesn't generally impact on blood flow. So even if we get it down to 10%, that's going to improve your blood flow dramatically. Thanks for answering your questions. You're very helpful. Thank you. Should exercise be in the heart rate target zone as much as possible? Yeah, it should. I mean, if you do a casual walk and your heart rate never goes up, well, your heart's got no reason to get any stronger. I mean, let's face it, we're doing exercise to become healthier, to make our heart stronger. We have to give our hearts a reason for that to happen. So yeah, you do need to make sure that you do get your heart rate going up to a good training zone, because that's the only way it's going to get stronger. What is the latest time to exercise before going to bed? No real good solid answer for that. For some people, exercise is quite a stimulant, and if they exercise and try to go to sleep 2 hours later, they can't. Other people, it's not a problem. I know back in my younger days, 30 odd years ago, I used to exercise from 9 to 11 o'clock at night, go home, go to bed, and I went to sleep right away. So there's not a real hard answer with that one. And Jerry asked me this question last week, and I'm going to answer it right now. Medication and sunburn. So we know that you've got to be careful with sun exposure. Doesn't matter who you are. The rates of melanoma are increasing and everything like that. So you have to make sure that you protect yourself from the sun. So making sure that you're wearing your sunscreens, or making sure that you're wearing good shirts with solid UV protection. For anybody that's had surgery, you want to make sure that the surgical scars are covered using zinc, so real good sun block cream on there, or even better, wearing clothing, that'll do it. There's some medications out there that will interact with the sun. Jerry, I'm not the best person to ask for this, but I know there's one type of medication called amiodarone, Amiodarone is a medication that we typically prescribe people who are dealing with heart arrhythmias. And there's an interaction with amiodarone and sunlight in the skin, and it can start to do funky colorings of your skin if possible. So it's not unusual for my patients who are on amiodarone to say, Rob, I can't walk outside. My pharmacist told me I have to be careful with sun exposure. So that's probably the best answer I can give for you, Jerry. You've got my email. If you got anything specific, send me an email, and I can always talk to one of our doctors and get a more specific answer for you. And then finally, we missed our exercise program on track. You know what, guys? So do we. All of our staff here, and I think I can speak for all of them, really do miss working with the patients face to face. We've got a wonderful team that really cares about what they're doing here. And the fact that they don't get to see all of our wonderful patients face to face is actually, it's disconcerting for us as well. So hopefully this thing gets a little under control. Hopefully we can start to open up the track, at least in some form, and we can start to see some smiling faces as opposed to just my ugly mug on the screen here. Okay, folks, let me just do one last share screen so we can see what's going on for tomorrow. Bear with me here. There we go. Oop. So tomorrow, our dietitians, Fatim and Veronica, are going to be doing a session on busting nutrition myths. So I know I caught a version of this. They did it for a graduate program I was running, I think a year and a half ago. It's a good session. So feel free to tune into that. Fatim and Veronica, excellent speakers, always worth catching them. So that'll be tomorrow at 1 o'clock. I'm back here Thursday at 1 o'clock. And as always, if you got any questions, please put them in the Q&A here. Krista will leave this live for another 5 minutes or so. I really do want to talk about stuff that you guys want to hear. All right, so if anything pops into mind, please put it in, and I'll promise I'll do my best. I can't answer everything. I'm not a doctor, but I'll do my best to answer as best I can. All right, folks, that's it for today. Have a great day. Enjoy the weather, and we'll see everybody on Thursday. Thanks all.